Hello everyone, welcome to sqadia.com. I'm Hina Khan, and today the topic that we're covering is geriatric psychiatry. It can also be referred to as psychiatry of the old age. It is also known as geropsychiatry, and it's basically the subdivision of psychiatry which is dealing with the phenomena that are more prevalent in the old age group, that is basically more than 65 years of age. So some of the situations we've already covered, and now we're basically concerning with the other prevalent situations such as anxiety disorders and the obsessive compulsive disorders, etc. over here in this lecture. So in this section, first we'll be discussing the anxiety disorders, that is the epidemiology, and then we'll move on to the symptomatology of the anxiety disorders, especially in the old age group people. Then we'll be discussing the substance-induced anxiety over here. So substance misuse is again a very common phenomena seen in the old age group. And alcohol is the most commonly misused drug that we come across in the old age. It is an underreported drug that is usually seen in the clinical situations. In the second section, we'll be focusing on to the geriatric anxiety over here. So how prevalent is geriatric anxiety? It's again, the symptomatology is quite similar to any other anxiety disorder in any other age group, for example, in adolescence or in the adulthood. But we'll be just discussing the symptomatology that is quite prevalent in the older age group. And we'll be restricting to the phenomena that why is it not quite recognized in the elderly people. And then we'll be focusing on the treatment and how do you basically treat the elderly people who are suffering from the anxiety disorders, because obviously we're going to consider this fact that they are already on the multiple medications out there in this old age group. So the drug interactions again are very common to discuss over here. In this third section, we'll be describing the sleep disorders primarily. It is a very common condition that is usually the old age group is suffering from the sleep disorders over here. So we'll be discussing the epidemiology of the sleep disorders, and then we'll be focusing on the normal sleep pattern, because knowing the physiology is again very important. When you're focusing on the pathology of a normal circadian rhythm, you should know what is the normal sleep pattern. Then the changes in the old age, which is basically the physiological changes in the old age, and then we'll be focusing on to the pathologies of this changes in the old age group. In the fourth section, we'll be dealing with the sleep disorders treatment. So how do you basically go about and manage these cases of sleep disorders? It's again very important. How do you evaluate these old age people? And the medical history taking is very important. You have to take a collateral history, because sometimes these people, they usually do not have the insight towards their problem. So to take the history from the primary caregivers is again very important. The non-pharmacological interventions will be discussed along with that. And in the fifth and the final section, we'll be focusing on the geriatric assessment over here. MSE, it's basically the mental state examination. And then we'll be focusing on the GDS 15. So it's basically geriatric depression scale, which is abbreviated as GDS. And it has basically, it is a 15 questions are put forth to the patient. And on the scoring of this GDS, we are going to score the patient accordingly, whether he's suffering from a milder, moderate, or a severe form of depression. And then the drug interactions will be discussed over here, because usually these people who are belonging to this age group, they're on multiple medications. So it's very important to consider this fact, and because the drug interactions are sometimes quite lethal or fatal for the person. So I hope you want to learn more about the geriatric psychiatry. So do watch the other sections to this lecture as well.